My name is Dr. Adele Perry, and I'm a professor of history and women's and gender studies. And as of July this year, I had the honor of becoming the director of the Center for Human Rights Research. The center has a mandate to foster research on human and Indigenous rights and also to communicate and discuss it. This is our first virtual, digital, or distanced event of this very unusual year, and we're really excited to have you all here with us for it. To say that at this point it's a truism to say that COVID-19 has revealed patterns and created new ones of who does the work of care and how we care for children, the ill, and for communities. The implications of these patterns for human rights were clear from the outset of the pandemic. And as we enter into what is widely recognized as a second wave, they are becoming clearer still. It has been 4 months since some, but not all daycares in Manitoba that were shuttered during the first wave have reopened. 1 month since public schools began. First Nations on reserve in Manitoba and Northwestern Ontario went largely unscathed in the first wave, but there is a different pattern emerging in the second one. Travel restrictions and border closures remain, and these, along with limits on gathering sizes, have enormous implications for how we maintain or fail to maintain connections across borders and in times of celebration and mourning and care. For today's roundtable, we have 5 speakers, each with remarkable expertise and knowledge on an aspect of care and labor and their relationship to both human and Indigenous rights in a context marked by COVID-19. We're going to proceed in alphabetical order, and I'll introduce the speakers as a whole first. Each of them will speak for 5 minutes, and I'll give hand signals as the 5 minutes come close. And then we'll have time for a conversation between the speakers, and then also take questions via Zoom chat. And this should all take about an hour. First up, we have Dr. Joyce Chadja from the Department of History at the University of Manitoba, and she'll be speaking about death and dying in a time of COVID, Harare 2020. Second, we'll have Councillor Roxanne Green from Shoal Lake 40 First Nation. She will be speaking on planning and projects in a COVID-19 environment. Third will be Matt Henderson, who is Assistant Superintendent of the Seven Oaks School District and a PhD student in education at the University of Manitoba. He will be speaking on towards equitable and educative experience in a pandemic. Fourth, we have Dr. Susan Prentice, Department of Sociology and also the Duff Roblin Professor at the University of Manitoba, speaking on childcare before, during, and after the pandemic. Finally, we will have Dr. Mary Sharif from the Faculty of Law and also a research affiliate at the Center for Human Rights Research and the Center on Aging at the University of Manitoba, and she'll be speaking on older persons' rights, isolation, ageism, and pandemic responses. I'm really honored to have these 5 very distinguished and engaged folks with us, and to have everybody joining us via Zoom. And with that, I will turn things over to Dr. Joyce Chadja.
Hi, sorry I was a little bit late. My Zoom just decided to update.
Of course.
right when I was about to join you guys. But thank you for the invite, Adele. So happy to be here. And my talk is centered on COVID-related deaths and mourning, but my focus is largely on mourning and how COVID has changed mourning practices in Harare, the capital city of Zimbabwe. The pandemic reached Zimbabwe on March 21, 2020. And at the same time, there was a malaria outbreak. So unlike COVID-19, the COVID-19 disease, malaria could be treated. But the reason why I mentioned malaria is that the 2 diseases share very similar symptoms. So you can imagine the confusion that brought to communities in malaria areas in Zimbabwe. The first confirmed COVID patient was someone who lived in the United Kingdom, was Zimbabwean, was going back home, but he survived. But the first death was on March 21. It was a young man who had traveled to New York, then went back home, where he came from a very rich background, was going around the city, even when he had symptoms, going to pubs and nightclubs, but he eventually succumbed on March 27. As of now, Zimbabwe has suffered a total of 7,898 officially confirmed cases. And from these, 6,424 have recovered, while 228 have died. It is still a puzzle among scientists why COVID-19 has not killed that many people, not just in Zimbabwe, but on the African continent in general. The number of cases of people infected and those who succumb to the disease have been very low in comparison to other places. And like elsewhere in the world, COVID-19 in Zimbabwe, whether the patient died at home or in the hospital, brought about what scholars call bad death. Because of the suddenness of the death, there are no goodbyes. Some might feel guilty that they did not protect their family, and the social isolation of the patient, as well as the bereaved family. In Harare, funerals are moments when families, like elsewhere, when families, villages, neighborhoods gather to mourn the dead and to pass condolences to the surviving family members. In fact, for Harare, funerals for immediate family as well as extended family members are a must-attend event, even more so than weddings. So you can imagine how the impact of COVID has had on, mourning the dead in the country. But since COVID-19 began, the government introduced restrictions on hospital visits and funeral gatherings. Suddenly, the mundane things that Zimbabweans did at funerals, like gathering for night vigils at the bereaved home for about 3 days, and other things that they did to comfort each other, like shaking hands, kissing on the cheek, hugging, crying, singing, the things that they did to remember the departed, and which also helped them feel comforted or get closure, were now being discouraged because there could be ways in which the disease was being passed on, to other people. In fact, I in my conversations with a few people, that I've been able to contact a few people who lost family due to COVID. One of the people that I talked with said that one of the comforting things about a funeral is seeing family and friends being sad. Then you're not alone. When you hear people say what the departed meant to them, it lifts your spirits. But we did not do that for my husband. His siblings in the United States and Australia could not come because there were no flights. And in any case, it was not safe to travel. It was perhaps the most painful thing about his death. One woman actually jokingly talked about her grief as being quarantined. So there are a number of things that Zimbabweans usually do at funerals, like cooking food, eating together, singing church hymns, and just personal touch, touching each other, that they are not able to do anymore. That has brought actually more grief to them, in addition to the loss of their bereaved one. And this is an ongoing research that I'm doing, and these are just my preliminary findings. People are generally, sometimes they're angry at the government because while they introduce a lot of restrictions, the government doesn't have money to help those who are in hospital so that they get better, because the government is broke. So, and a lot of people are unemployed, and most of them they did informal work, which involved being outside with the people to get money. And now they cannot do all that because of COVID. So it has brought in a lot of hardships that have not only worsened or made it impossible for people to engage in their economic activities, but also made it hard for them to do most of the things that they usually do when somebody has passed on at a funeral, to say goodbye to the beloved who has died. I will stop there.
Thank you very much for that really powerful introduction, and I think a really great way to begin this roundtable that pulls together a lot of the threads that will come up again and again. With that, I will turn things over to Councillor Roxanne Green.
Thank you, Joy, for your presentation. Thank you, Adele, for the invite to come and present on care and COVID and the age of COVID presentation. Thank you. Speaking from the perspective of a First Nations community, Shoal Lake 40 is quite known to struggle. So when we were hit with this pandemic, automatically we went into crisis mode, and everyone pretty much knew what to do in a way. And in the beginning, we were guided by the elders. So it was the elders that gave us guidance, direction, and what we should do as a community overall to protect ourselves and everyone in the community. So what we did was, after we had the guidance from the elders, we met as a team and developed our pandemic plan for the overall community, and identified a pandemic planning team, which consists of a few members of our council, chief and council. We're fortunate enough to have a nurse as a part of our team in Shoal Lake 40, and she's also from Shoal Lake 40. She's a part of our pandemic team, and she's the health lead. We also have our chief, Vernon Red Sky, who gives us that strength and that direction as a team. We've got Don Morrison, who's an MBA and also our director of finance. So any funding opportunities that we can tap into, we've done that. We were probably one of the first First Nations to submit a pandemic plan proposal, and we were able to obtain funding for our overall planning. We also have a former Treaty 3 police, which also he has a combination of 15 years construction experience. So everyone has something to offer. Myself, I'm a facilitator. So I've been heavily involved in the community's planning throughout all the years. So with everyone pitching in, everyone has something to offer. We were able to quickly mobilize and act rather quickly. And as a team, we keep each other going. We motivate each other every day. We were operating in crisis mode for the first few months, and over summer, things kind of slowed down a little bit. And the unique story about Shoal Lake 40 is not only did we get a freedom road for our community, which granted us a human right to come and go to your home whenever you want. It has also provided us opportunities for more projects in the community, such as our, I'll just go back to our team here. So Helen, if you want to share that first slide. So this is members of our pandemic planning team here, and this is how we work as a team. This is a mock scenario that we did with our school and our daycare staff and our pandemic planning team. And it's a process that's used so that we can look at gaps, what did we miss, what can we do better, and we do it as a team, so that way everyone can contribute or make a correction in one way or another. So I just wanted to share this. This is a process that we value, and this is what works for us as a team. Thank you. You can leave that one. So with our projects, we had to think, okay, we have two major projects going on, a new school, a water treatment plant, and we were faced with a big decision as a council whether or not we should continue those projects, because knowing that the greater risk to us in someone getting COVID within the community. So yes, we have a good pandemic plan as a community, but we needed to develop something specific to our projects. So what we did was we started working with the project people for each one, and working with them and making sure that their COVID and protocols were up to par with ours. So we wanted to make sure everyone had a high level COVID-19 protocol in order for those projects to move forward. So Shoal Lake 40, again, exercising their jurisdiction in their communities and making sure that the projects keep going, because water is a human right, education, those are essential projects. So we were faced with decision on shut them down or keep them going. You know, what's more important? Do we want clean water later or sooner? So those are the hard decisions that we've had to make as a community and as a pandemic plan, and they were the right ones. Because of that, in 8 months, our school will be done. Next year, our water treatment will be done. We'll be drinking clean water finally. We are the second longest boil water advisory community in all of Canada. And we're all waiting to be taken off that list and have clean drinking water right from the tap. So I feel pretty confident in our decision to keep the projects going. I can't emphasize enough on how great our team has come together to make sure that we keep the community safe at the same time. We have a checkpoint in the community that records all the contractors. We are closed pretty much to visitors. We're only open to community members and band members. We have so much traffic in and out from contractors. We have a health and safety officer, if you want to go to the slide with the two gentlemen there in construction gear. So on the left is Dave Redsky. He's our health and safety officer. That's the one I was mentioning that has the Treaty 3 background and the construction background. So he's our health and safety. He goes around to all the sites and our camp to ensure that everyone's following all the protocols. He's got a checklist that's been developed by our nurse, our RN here. So she works closely with him to make sure everything is the way that we want it done. And then on the right is Billy Wape. He's a counselor as well, and he's lead on the water treatment project. And these were just taken two weeks ago. So we have these guys checking the sites all the time, and Dave especially, he's our go-to for health and safety in the community when it comes to the projects. Thank you. And then you can go to the water treatment plant picture. Well, it doesn't matter which one, I'll explain them. So any picture that you have, there's only 2 more photos. Okay, yeah, that's our water treatment plant. So this water treatment plant is, it's coming along, it's actually on schedule. So everything's going really well there. It's actually just down the road from my house, and it's exciting to see all the traffic going back and forth. I hear it every morning when I wake up. It doesn't bother me. It's a rather welcoming noise, I guess you can say. The next photo, please. Okay, yeah, and this is our school. So this, the water plant and the school are actually 2 major projects that are on the same road. So there's constant traffic. We have local community members that are employed at both sites. So it's pretty exciting right now, and we're doing what we can to keep everybody safe through weekly updates with our pandemic planning team and the contractors themselves. So they all know the importance of keeping everyone's protocols up at to par with each other. And if one is not up to par with each other, then we, make adjustments, and we make sure their protocols are good enough so that we feel comfortable enough to keep our community protected. Overall priority is making sure our community is protected with those projects going on. As a community, we also have our health lead, Brenda Friel, who's a councillor. Any issues that need addressing within community, she's in charge of that. We have Ashley McLeod, who's our education portfolio holder. She brings the school together, and they've developed a back to school plan and a daycare reopening. Right now, we're all remote learning, so we're not open right now. We're not comfortable with opening, sending kids into the classroom at this point, so we're doing remote learning right now. That's why I'm at home with the kids right now. And yeah, we're pretty much monitoring the situation day by day and meeting weekly with our pandemic planning team alone and pandemic planning team with the contractors. So the big part of that is making sure that we keep health and occupational safety as a priority. Because we're a border community as well, we have to ensure that our protocols meet the standards of Ontario as well as Manitoba. So we're very in a unique way, but we're doing pretty good, and I'm quite proud of our team. We haven't had any cases in the community yet, but in the event we do, we'll be prepared, and we're doing what we can to keep our community safe at this point, and I'm really proud that we're still able to keep our projects going. And that's about as much as I can say to that for now, and thank you.
Great. Thank you very, very much for that, and for that really important look at what's going on at the ground at Shoal 840 in response to COVID and in relationship to other human rights there. So thank you very much, and we will turn things over to our next speaker, who is Matt Henderson. And I know Matt has a lot on the go, but he is there. I can see him, and I will turn things over to Matt.
Thanks, Adele. And Adele, thanks for including me, and Joy and Roxanne, thanks for sharing. I think what you've shared dovetails into kind of what I'm going to talk about in terms of the school system, the education system, and how it has and we have responded to COVID, both in the spring and then and now, and sort of some of the knowns and the unknowns, and how that impacts our families. Helen, do you want me to share sort of photos that I have? Is that better? Okay, I'll see if I can do that. Anyway, actually, no, I probably won't, because I might share my email and things will go askew or something like that. Anyway, but what I was going to show is Adele and I were actually working on a project with some high school kids related to historical thinking. I'm still a history teacher, and we were having them kind of look through primary sources. Oh, there it is. Well done. Perfect. So this is a copy of the Winnipeg Tribune from, I think, December 2nd, 1918, and you see the headline maybe there that says "Kiddies troop back to school after 7 weeks just playing," and I come back to this. If you read, you can't read the article right there, but the reporter 100 years ago tracks down a 7-year-old kid, which is quite fascinating, and is saying, I'm trying to interview this kid about what he did while he was away for 7 weeks. The kids were away for 7 weeks in 1918, and they were just coming back that day. And then the kid sees some buddies and skirts off and is gone. And the reporter's like, "What the heck, man?" But what it shows is that school was back. And that what that child needed at that moment was friends, was fellowship, was school, was sort of the nurturing notion of what we do every day in the school system. And so that really got me thinking about kind of what has happened to us in the education system, and what might happen. And so I'm just going to talk briefly a little bit about sort of what has COVID made visible that we kind of already knew before COVID, in terms of rights, in terms of every child being able to access high quality educative opportunities. Some new things that we've discovered, for better and for worse, and then kind of sort of come back to the idea of like, but who really is most impacted? And so the big question for me, I think, comes down to is what happens when schools are shuttered? What happens when, and this is the experiment that we're living in, is what happens when we shut down school? And I think for the most part, what we've seen is that for those families who are most vulnerable, and so that's racialized families, those are families living in poverty, those are families with children in care, that they depend on schools. School is more than just a place where they learn, but schools are a massive support system and also a pillar of the community. If you come by, and I'm just going to plug Seven Oaks, of course, if you come by any of our high school common areas in Seven Oaks under normal conditions, they are packed every single night of all sorts of things happening. The Filipino Basketball Association, Bhangra dancing, they have become the new hubs that maybe religious institutions used to play. And so when we took those away, we saw that not only did we sort of become divorced from the relationship that we have with families and families have with schools, but that also many of our learners languished. And that I think sometimes we sort of said, oh, well, we'll do remote learning. And assuming that, and there may have been assumptions by some that, well, families can handle this. Meanwhile, that wasn't the case. And we knew darn well that there were many families with one parent, maybe one parent that is sick as well, multiple children, and the only device is one cell phone with a pretty crummy data plan. And so that's an unrealistic expectation there. And so from our perspective, we had to sort of mediate that with a different kind of remote learning, which was we're actually going to meet you on your sidewalk in your front yard. And that's how remote learning is going to happen with especially wee ones. But it did provide challenges in the sense of we still had teenagers and adolescents who were sleeping at night or who were sleeping during the day, up all night. They weren't able to participate in sort of what we might call the co-curricular experiences that really draw kids into school. So whether that's athletics or the arts. And we found that well-being suffered amongst families, amongst our learners. And luckily, we've been able to come back into schools, but I still think that there's a significant impact for all of our schools in the system. K-8 students are in every day, but it's a strange experience. I don't know if I hope you haven't been walking through a school because you're not supposed to. Oh, I'm at 5 minutes. Shoot. Okay, give me 2 and then I'll be done. But we found that like there's still an eerie divorce. High school kids are in every second day, which is significant in that we're not able to have the contact with those kids. But it also places our teachers in a position where they may not be able to, and I'm not saying all, but some may not be able to adjust and pivot to be able to offer powerful educative experiences that have purpose, that are authentic, that actually move to transformation if we want to get into Dewey, in a hybrid situation. And I think we're going to see a real significant gap there. And Sal Khan from Khan Academy was on the Harvard EdCast last night, sort of talking about there's a difference between online learning and remote learning, right? Like he wants his kids to be in with a caring, loving teacher, and where there might be occasionally some online learning, but remote learning is a different thing. And the last thing I'll say in terms of new patterns is that what we're finding is that we have to be cautious about this push to remote learning, which is coming. We have to protect ourselves from sort of that kind of becoming a theme after the pandemic. And to sort of say that this is something that, hey, this worked out really well in the pandemic, we should continue remote learning, and that maybe we can scale back on some of the regular K-12 system that serves our kids and families really, really well. So that's a new pattern that has picked up, but I'll leave it there for now.
Thank you very much, Matt, for that and for taking time out of a very busy day to bring us another really important perspective on the way all of these issues kind of coalesce. So with that, I will turn things over to Dr. Susan Prentice.
All right. Well, thank you very much. I'm really very happy to speak on a panel where childcare is framed as a human right, because it is, even though it doesn't always make it onto the list. Just in case anyone needs a refresher, childcare is mentioned in CEDAW, the Convention on the Elimination of Discrimination Against Women, and also on the Convention on the Rights of the Child. So those are touchstones for you on human rights. It's also what Marshall called the extension of rights more broadly to social rights. And if that doesn't persuade you, everybody relies on somebody who relies on childcare. So it's on everybody's agenda right now. So I titled my talk Childcare Before, During, and After COVID. So I'll move through these three phases, because I think you can't understand what's happening now and what might be coming if you don't know where we have been. So, you know, in the before times, Canada had a very small supply of very expensive childcare services. Most children and families live in what we call a childcare desert. They live in a neighborhood where there just aren't services or they can't afford them. In Canada, we have a regulated childcare space for less than 1 in 4 or 5 children who needs it. That's nationally, and that number is higher because Quebec pulls our average up. Here in Manitoba, it's much worse. Here in Manitoba, we have a childcare space for just 18% of children, which means many, many children are in unregulated, unlicensed, kind of gray markets. And I can't talk about that because we don't know anything about those places. So my talk will restrict itself to the licensed services that we've got. Licensed childcare is very expensive. All across Canada, many parents are paying more than $1,000 a month per child. I've got friends in British Columbia who are paying $1,800 a month for their kids. Manitoba fees are a little bit lower, although today's throne speech might change that. I'll have to watch and see. Manitoba only looks kind of affordable because the rest of the country is so hideously unexpensive. And in licensed childcare, I have to speak frankly, the childcare quality is not as high as it should be for lots of reasons, but mainly inadequate pay to the early childhood educators and low public investment. So that's where we were. So then COVID hits. What happens when COVID hits? Programs close immediately, just like schools did, although some reopened quite quickly to serve the children of essential workers. There was lots of turmoil and chaos in the sector, lots of distress for families and children and policymakers. In Manitoba and one of just 2 provinces, parents had to continue to pay fees even though they couldn't use the service. Ontario, Quebec, PEI, Yukon, and Newfoundland made different policy choices. They paid extra money to childcare programs. They relieved parents of their fees. In Alberta and BC, the cost of care fell because governments increased their funding. Manitoba, by contrast, neither reduced nor eliminated any fees to any parent, didn't give any extra funding in a meaningful way to the facilities that we're trying to operate. One of the ironies that happened during COVID was that many of the laid off childcare workers discovered they made more on CERB than they did while working in childcare, which says something dreadful about the state of funding. So what's happening now as we're in month 7 of the pandemic is that although many facilities are reopened, the sector in general is quite fragile. In Manitoba, 1 in 7 facilities remains closed. Many centers are open but operating at less than full capacity. They have higher costs but lower revenues. Many parents, of course, have lost their jobs and had to pull their kids from childcare because they couldn't afford it. And if and when jobs return, this means they'll be facing a pickle because it'll be hard, long waits to get back into scarce childcare. Some of the staff in centers can't work because of their own childcare needs or family care needs. Some families and staff are worried about health and safety, and we're not always supporting the sector with the additional safe operating PPE and the rest that would be needed. So we're in this paradox that many centers are running at less than full capacity, but running with unfilled spaces, and yet many parents looking for and being unable to afford childcare. So basically it's a policy mess out there. There is a small piece of good news in all of this, and that is that there is some meaningful federal involvement for the first time in a very long time some awareness that it's really time for national leadership to help build a national childcare program and to help encourage provinces and territories and to coax some of them into policy and program that they might not otherwise do. And yet there are retrograde moves underway in a couple of provinces and territories, including ours. So I would say that the future of childcare is perhaps more uncertain than it's been in decades, even though the public awareness and even political awareness of the important dimensions of childcare are more visible to more people than ever before. Thanks.
Thank you, Susan, for that really important discussion about childcare and COVID in the particular context of Manitoba and Canada, where these questions are pressing and where we have seen more conversation, but it is not clear where all of that will lead us. So thank you for those important interventions. So I'll turn things over to our fifth and final speaker, who's Dr. Mary Sharif.
Thanks everyone for the opportunity to join this discussion today. And I'm hoping to stay in that 5-minute break. So here goes. All right. So COVID-19, apart from it being a virus, is as we all know, is a community-related infection. Community-related, which means that COVID's given us the opportunity for tremendous insight into how we socially operate, not only in terms of our immediate physical interactions, but how we order things and how we respond. And so this reflects back to us a real-time snapshot of the results of our collective journey to date. That's the way I kind of look at it. So thinking about the snapshot, and of course I'm talking about this in the context of long-term care and older persons, what was exposed? Well, the first reported case, should put my timer on. The first reported case of COVID was in January 2020 in Canada, after which then we had an increase in the community spread very sharply by March. By May 8th, there were 4,740 COVID-related deaths in Canada, of which 82% or 3,890 deaths were in Canadian long-term care facilities. The government response to control and prevent that transmission then included reducing non-essential visitors and restricting staff to one facility or working in one facility. And those initiatives had two very critical impacts. First of all, there was increased isolation of residents in those facilities without as much access to certain caregivers or close others who were not able to visit. And there was increased stress and increased workload on staff. The reports from the dire situation in some of those facilities, particularly in Ontario and Quebec, led to federal military deployment into those facilities, I think around 30 at the time. And the military was brought in to provide medical support, but also humanitarian relief. And it's really hard to think about needing humanitarian relief of that nature in Canada. And what did they find there? Well, they found poor infection control. They found inadequate disinfection protocols. They found sometimes near to 100% contamination rate, and resulting from a lack of training, a lack of access to resources, understaffing, as well as overworked staff. But they also found a significant, and we would have all read this in the media reports, significant abuse and neglect of older persons, including degrading and inappropriate comments to residents, forceful and aggressive transfers of residents, even when they complained of pain, no bathing or for weeks or changing of clothes, leaving residents in soiled sheets or incontinence products, forced feeding, forced hydration, sometimes leading to choking, or conversely, no feeding, no food, or putting food and personal items out of reach, leaving people on bare mattresses on the floor so they couldn't get around or have mobility, and then use of sedation to address residents' sadness, fear, depression, when there was no actual person to provide care or companionship. So how do we organize our thinking around all of this? Well, first of all, we can hear that kind of list and we can appreciate that those are all kinds of, all forms of violence. Physical, psychological, emotional, abuse and neglect, the loss of dignity and respect, all constitute violence and are all considered violation of human rights. If we think about this from the perspective of what it says about our Canadian community, and within that larger community, these smaller, more isolated communities of older persons, we can make some extra observations. In that decision-making, the policy decision-making, we see a utilitarian approach, right? Utilitarian ethical or moral thinking. Evidence-based, yes, because trying to contain and reduce transmission, but nonetheless policy that exacerbated or even tipped over situations that were already acute to begin with. I would also argue that there seemed to be a blindness or perhaps carelessness with respect to well-documented darker aspects of human nature, right? That can potentially be provoked when people are put under stress or pressure. Now, what am I actually saying there? Well, there's data that shows that abuse in long-term care facilities is pervasive. We also know that their isolation is the primary vice that underlies abuse. So isolation measures need to be carefully balanced with the concept that isolation can facilitate abuse. We also know that abuse of older persons is understood to be driven by agism, and then agism is entrenched in our institutional and social structures. And examples would be mandatory retirement, isolation of individuals into smaller communities, and so forth. All right, so some of the new initiatives in terms of responses to the pandemic, and I know I've got about a minute left here. Practically speaking, there's been the use of tablets to improve visits with family, the use of outdoor spaces to connect with close others. There are also, from a legal perspective, several individual lawsuits against long-term care facilities, as well as class action suits. And caregiver initiatives are taking place where caregivers are arguing for their own rights, including right to information, right to advocate, the right to provide emotional and spiritual support, as well as to be able to comfort and touch their loved ones. In terms of human rights generally, and I'll just wrap this up right now, when that light was shone on the pandemic impacts within long-term care facilities, there has been a call to use a human rights approach across the board to inform policy development and responses, regardless of whether one can actually situate that right in a specific human rights instrument or document. The thinking is that if we can conceive of violence to older persons as a breach of human rights, rather than attaching that violence to the concept of vulnerability or to a list of activities that we would define as abuse or neglect, if we use it as a breach of human rights, this can help us illuminate the contours of systemic ageism, and then give us an opportunity for more expansive thinking when it comes to envisioning our social structures and responses. Thank you.
So I want to thank all of our 5 speakers who I think brought really different perspectives on the way these questions of work, of care, of human rights come together in a context, an ongoing and changing context of COVID. This is a lesson in how quick 5 minutes goes, but I want to thank everybody for keeping their comments really brief, and we have some time for conversation and for questions. And so I'll first just open the floor up to the panelists if there are questions or points you'd like to make to the other speakers. If any of our panelists have questions or comments, this would be a good time for them. No? Okay, well, maybe we can just bracket that. If you have questions come up, we can bring them up, and then perhaps we can take questions from the guests, the audience, such as it is, and have them on the comments box. So you should be able to, in the chat function, raise a question if you like. Yes, so Susan Prentice has said she's happy to answer questions about childcare. So Susan, I wondered, I'm just going to ask you a question about childcare since you're happy to answer questions about childcare. You talked a little bit about the unhelpful provincial response in Manitoba. Is that something you could maybe use this as a moment to sort of give us a little bit more context about?
I can. The clearest signal about the province's unwillingness to do much on childcare is that the last time they increased the operating grants that centers and facilities get was in 2016. So in 4 years, funding has been completely frozen. It buys about 7% less this year than it did in 2016, and it was inadequate in 2016. And centers are really suffering right now because they had inadequate funding then, costs have gone up now, and public health requirements to operate during a pandemic have put even increased costs on them. So if this was a government that wanted to do good by the economy, make sure that workers are ready to go to work, that there were people ready to be staffing our restaurants and our public transit system and our grocery stores and all the rest, they would take childcare more seriously. And yet in today's speech from the throne, which I took a quick peek at, all they talked about is the need for a new funding model as we wait to hear what the management firm KPMG proposes, and the odds of them imagining publicly funded, universally accessible childcare are dubious.
Thank you very much for that update. And yeah, we'll have to pay attention to all of this as it unrolls. And I'm always struck by the fact that, you know, federal governments have acknowledged the good idea status of national childcare for as long as I've been alive, with the noted exception of the Harper government. And now we're clearly back to that. And these are really important days for whether there is movement on all of these questions. So do we have any other questions for any of the panelists, for Roxanne, for Matt, for Joy, for Mary? Joy, one of the things that I'm sort of struck by is your kind of framing of the bad death, and in a way thinking about different kinds of deaths and the way it also connects to some of the very important issues that Mary raised. And I'm wondering, you know, does this also get re-articulated in a context where there's new limits to travel, where there's particular kind of constraints put on connections maintained across spaces? And so to what extent these questions of COVID and mourning are rendered different by a context of kind of connections between families and kinships and communities in different sort of spaces?
That's a good question. Actually, in terms of travel, from March, I think up to about July, no, up to early August, thereabouts, I don't quite remember, but there was a very strict restriction on travel. People could not move from one neighborhood to another, or in the rural areas from one district to another. In fact, there wasn't even any public transport. Right. Those who were using their own private cars when traveling could be stopped by the police at any time. You had to have permission to move from one area to another. Otherwise, you were supposed to stay put and be able to go into grocery stores within your neighborhood and not necessarily, move like you would have done prior to COVID. So that obviously affected the way that funerals were held. Whereas before COVID started, when somebody dies, relatives will start, going to the deceased family's house, whether in the rural areas or in the city, and they would stay there and actually sleep there for several days until the person was buried. So usually that would take about 3 days of mourning. where they would be, you know, singing throughout the day and night, and whenever a new person arrives, everybody is crying, people are hugging, people are shaking hands. Now all this could not be done. But in addition to that, you know, the people were not allowed to move. There was a restriction on mobility. So that's about people in Zimbabwe. But in addition to people in Zimbabwe being not being able to move from one area to another, there is also the diaspora aspect of it. Because Zimbabwe has about 4 million people out of the country in a population of about what, anything between 14 and 15 million. So whenever somebody died, the diaspora usually is when it's somebody within your immediate family, like a parent, a sibling. Then people would go home, you know, to mourn. But during the time of COVID, at one point there were no flights at all from particularly from Western countries to Zimbabwe. And in South Africa, there's also a large you know, number of Zimbabweans. While South Africa is close by, it was also not easy to travel. But what happened with South Africa was that a lot of people who had been working in South Africa suddenly found themselves without jobs. So they could not sustain themselves, and they had to go back to Zimbabwe. And yet South Africa was the epicenter of COVID on the African continent. So it meant that some of the people who were leaving South Africa, going back to Zimbabwe, were bringing the disease with them. And the government, since it doesn't have resources, did not have the means, you know, to deal with this group who were supposed to be quarantined for 14 days. Some would get into the quarantine centers and just run away. And the government had no means of tracing them. So that became one of the biggest problems. And in the process, they were also, you know, passing on the disease in the communities into which they were going. So a large number of the people who ended up with COVID in Zimbabwe had been in contact with people who either came from the United Kingdom or from South Africa.
Yeah, thank you very much for that. So I'm just going to go to a question we have now from Annie, and I'll just read it. It's a question particularly directed to Mary, but there's others that can perhaps weigh in. And what they write here is, I appreciate the recontextualization or framing of elder abuse as systemic agism. I'm wondering if she had any examples that would contrast the difference between pursuing a systemic or individualized or localized change. By contrast, how did pursuing change at the different levels differ in terms of process and results? And then Annie goes on to give a little bit more context to this sort of tension between community organizing and policy and then grassroots work. So she was wondering if you could speak to that, Mary.
I can try. Thank you for the question. So I'll just give some examples and see if we can sort of move this between sort of the systemic pieces and individual pieces. So there is this thinking that and it's kind of a vicious circle, but there is this thinking that ageism and discrimination of older persons underlies elder abuse and neglect, right? So here is an example. In Canada, there's no specific definition of elder abuse or neglect, or you'll find definitions in different pieces of legislation. So in order to be able to address elder abuse and neglect, you would have to try to locate it somewhere in a particular context, in a specific context, whether it's the assault provisions or sexual assault provisions in the criminal code, whether it's with respect to persons who lose competence, and so then there's an order requested to try to be able to stand in the place of that person or to make medical decisions for that person and that kind of thing. So there's sort of a completely, the right word's not discombobulated, but there's just a piecemeal approach to how do we actually deal with older persons, right? Now, if the question then becomes, when you look at those definitions within these different pieces of legislation, for example, you will see that there's a tying of the activity that causes harm to the older person to notions of vulnerability, or breaches of trust relationship. And so there's a big question whether the activities that might harm older persons actually has to hinge on a breach of trust at that individual level, right? I'm hoping this is making sense. That if one were to actually take that outside of the breach of trust relationship or of a vulnerability perspective, that one would actually just see these individuals, older persons, as just individuals with inherent dignity and rights, okay? And then that can preemptively address some of the situations that tend to unfold. I don't think I'm answering this question very well, and I'm mindful of the time. Yeah. So one of the things, an example would be, so for example, there's a call after the pandemic to actually change the Canada Health Act to include long-term care facilities as part of insured care, or something to that effect under the Canada Health Act. But there's also a question about, is this actually just health, right? Because this is also the homes of individuals, right? This is where they live. They're residents in a particular place. And so there's a narrative here that relates to the disability rights narrative as well, that this might just actually be accommodation kinds of circumstances. And so at a systemic level, one would look at a human rights approach to actually remove it from being a function of individual relationships or a function of how we might actually create vulnerabilities within a larger system. So that's the best way I can answer it for now. I can certainly provide further examples at a later time if we're connected on email.
Great, well, I'll definitely put you into contact with one another. So I'm going to use a bit of a chair's prerogative just to have one more minute beyond our 2 o'clock proposed end. Or maybe it's actually 2 more minutes. And that is, I know that Susan Prentice has a question for Roxanne Green, and we'll take that as our final question. So Susan, do you want to ask it?
I do. My unmuted, I am. So I was really interested to hear about how things are progressing for your community. And I was thinking about, across all the panel presentations, the different degrees to which a well-funded established system like healthcare and education can manage, the way a non-entitlement system like childcare can suffer. And I wondered what you thought things were at in terms of the sorts of intermediate state of kind of governance around your First Nation, and what kind of steps you think help make, it kind of builds on the question that Annie asked about, when do we institutionalize and make projects safe and secure and able to sort of survive in a institutional way, not just at a one-off or an experimental or a kind of provisional individual level way.
Thank you, Susan. Yes, I can certainly answer your question. Well, first of all, I'll go back to our governance model, which is basically the foundation of our overall community. The governance model is based on the women, the men, the children, and the elders. And like I mentioned in the beginning, when the pandemic was first declared a pandemic, we took the direction from the elders, and they're the wise ones. So we listen to them. It's not chief and council telling the community what to do. We go back to the members, to the people, and look for their guidance. And then from there, the first slide I showed of the people that were planning, we're used to being able to mobilize and plan in that way. And it's a facilitated method that we've been practicing for years and years. I know some of you guys might know Kyler Cotton. He's also a facilitator, and we have the same training. And we basically rely on our governance model. That's what gives us the strength. It gives us the support that we need in order to implement any work and planning that we do moving forward, looking at it in the project scope and looking at it in the community level. So we have to plan in two different ways. And I can't say one is more important than the other, because the project scope may impact us as much as a community scope. So going back to the checkpoint, security checkpoint we have not only records who's going in and out, but it's a valuable tool for us if we needed to do contract tracing as well. So really it's the people that guide us in our planning, and then we use our pandemic planning team and our council to put together those pieces, and then we go from there, and then we get the support from the members themselves.
Super interesting to hear how well the governance has been working, and really nice to see pictures of the school and road coming on. That's great. Thank you.
Thank you.
Well, I want to, so we went just 5 minutes over our time, but I think that's pretty good all considered. We had a really remarkable opportunity to hear from 5 different people who bring different expertise and knowledge to these questions and how they fit together. I want to thank all of their speakers for their insight and their engagement and their willingness to weigh in. Matt had to get back to his various projects, but we'll send him our thank you in another way. And I will bring the session to a close. And again, I'll ask you to stay tuned for more events at the Center for Human Rights Research. Next up is an event that'll be co-sponsored by us, the University of Manitoba Press, and the Native Studies Colloquia, which is a book launch for Brittany Luby's new book, Damned, which is a study of Anishinaabe survival and the environment in Treaty 3 in the 20th century. And that is coming up on October the 21st. So stay tuned for that. And thank you again for joining us for this first effort of us to go online and have these discussions in this way. Thanks very much.